this is your new unit.
This is our new unit. We're under construction now. We should have the last 2 labor rooms done by the end of next week, and our nurse station is going to start on July 7th, and it should be completed by July 20th. So that should be all wrapped up by the time you come in.
Wow.
Yeah.
So sooner than expected.
Sooner than expected.
That's
Actually,
awesome.
they're meeting all their deadlines, and we're really pleased with the outcomes of all of the construction. It's been terrific.
It looks beautiful.
Thank you.
It's nice to come to a pleasant place to deliver and have a special moment. So what else have you done as far as your renovations?
Well,
I
other
see
than labor rooms
flooring
and the
and paint.
floors, we've done the OR floors, and so that's kind of brought it up to snuff. And we're going to redo our recovery room and all the common hallways. Everything that you're going to see is going to be nice and bright and fresh and clean.
Awesome. And so this is going to continue.
Right, but we're still.
Your other units.
This is going to go into 5 West and 5 East in the next fiscal year. But right
And
now we're still.
any part of it postpartum.
It's antepartum and postpartum. Right, but we're still working within the construction, although we have it all cordoned off, and so that we meeting infection control purposes, and that they're coming in and doing, any checks, air quality checks, to make sure that we're not exposing our patients or the staff to any issues.
Well, the noise seems very minimal.
It is
so
minimal.
It's
We're
nice.
really working, and they have everything vented to the outside, so we really haven't been impacted at all for living in this unit. And that's the wonderful thing about MUSC, is that you've got such quality people here that that's what makes the care. I mean, even when we were living in our old facility,
Right.
the one that we've been in 15 years on this side, we're still delivering the absolute best quality and have the terrific satisfaction scores, and that when you have somebody who comes in with an unexpected outcome, we still are able to deliver and meet their goals.
I think one of my things for delivering here, expecting to have a normal delivery, regular delivery as it could be, you guys are used to handling the worst case scenarios, and
We are, because we deliver all the high-risk pregnancies in the southern portion of South Carolina. Anything that is thrown our way, we have multiple layers of staff and multiple layers of disciplines that are able to address the need of the child that has either special needs, unexpected outcomes, moms who have taken a turn for the worst. This is what we do. We do it on a daily basis, so this is nothing new. We're experts at it.
so I'm one of those lucky women who are actually delivering during football season. So to see this TV here is huge for my husband. So tell me some things that Nick should expect during the delivery. How can he be helpful? Those kind of things.
Well, usually the guys are feeling like they're a fish out of water. Once they walk in the birthing room, they really feel like they've lost control. So we really do a good job in trying to incorporate them into what you're going through. So we say, you need to wipe her brow, you need to hold her hand, you need to make sure that she's relaxed. But once you get your epidural, if that's where the bridge you're going, then you're able to relax and sleep, and he can sit here and watch television. He can go it's a good time to go take a break. He's making phone calls. People are welcome to bring their laptop. MUSC has Wi-Fi, so that they're able to just do whatever they need to, so they're not missing a beat. But frequently dads will just sleep also, and they have the facilities here. We have these chairs that actually pull out, and we give you a pillow and a blanket and get some rest, because this is a stressful time for them also. They're welcome to bring food in here if it's okay with the mom.
Okay.
What I could suggest some things that you bring to the hospital is
Yes.
a pillow or two for him as well. Our pillows are they're hospital grade. They're flat and not a lot of loft, not very comfortable, and so that would be good. Toothbrush, toothpaste. Ours is a little bit industrial also. Any money that you might need for the cafeteria, or he may need for the cafeteria. Your cell phone, you're welcome to use. Bring your charger. Frequently people's chargers run out, but make sure you take that when you get transferred out of the room. A camera. Make sure your batteries are good in your camera, and you have a memory card with space on it, so you're not deleting pictures.
Videoing and camera is
Well, videotaping's fine, but what we generally recommend, you can videotape all you want, but during the actual birth, we ask that you come to the head of the bed. Whoever's taping, the camera comes to the head of the bed and angles from this point, from this perspective, so it's a little bit more tasteful, and that you get some decent footage. You can still, because what you'll see is that you'll see the baby's head, And then you'll see the birth of the baby, the physician actually catching the baby. But, and the husbands can cut the cord.
Right, I saw that in the birth plan.
Yeah.
And Nick will be excited.
Yeah,
to
and that's
involved.
always sweet. In store
And
for
so
the
I assume
dad.
you're in a night or a hospital gown during, but I've also heard that you bring gowns and that sort of thing.
If you'd like to, yeah. You generally are put in a hospital gown when you come in, but you're welcome to bring whatever you'd like to be wearing afterwards. The reason you're in the hospital gown here is that your back's open so that you can get an epidural if you're interested. It's easy access for us and for anesthesia if you should have to go for a C-section to put your leads on. That we're doing your laundry. Birth is not always a clean process with the amniotic fluid after your water breaks because you're sitting, in that. Although we try to keep you as clean as we can, there's still some fluids. And then with breastfeeding, it's easy access to get the gown on and off so that the baby can latch on.
So do you want to show me now where we go, or the OR, how close it is?
Well, the OR is right across the hall. I mean, it's like you walk out of this room and it's right across the hall. We can't go in because we need to dress for it, but I can show you the proximity. It's right here. And we have 2 ORs, like I said, and it's got the stabilization unit in between. Okay, so it's as simple as opening up this door. We would just wheel your bed right in here. The stabilization's here, and there's a little doorway in between these rooms, but our ORs are right here. And it's all standard operating room. It's got the OR table, the anesthesia equipment, a back table, and it's very...
And is this the isolate that a child would go?
This is actually a transporter for the NICU, so if there was a baby who was extremely premature or had anomalies and needed to go up all the way up to the NICU, this is how we would transport. A healthy baby, one that's going to level 1 or even level 2, can go in a bassinet.